Okay.
Yeah, you are live now.
All right. So we were just talking about the various sites of hemangioma before we had this disconnection with our service. Anyways, so hemangioma can involve any part of the face. It also involves other parts of the body. We are a specialist in treating various hemangiomas that occur in the head and neck region. Now, hemangiomas could be cavernous, could be capillary. We also have high flow. We have arteriovenous malformation. I'm using that term loosely so you can understand any tumor that comes out of a blood vessel or blood. Now, more commonly cases involves the lips, as in this patient. It can involve either the upper or the lower lip. I've seen more cases involving the lower lip. Different sizes from a few millimeters to many centimeters. It can involve the tongue, as is involved this boy. It can involve the chin. It can involve any other part of the face, even eyelids, nose, forehead. Any part of the face can be involved. And depending on the size, depending on the nature of the lesion, the flow of the lesion, the age of the patient, so we have to do the surgery by not just removing the tumor in toto, because this is not a cancerous lesion, which means it doesn't kill the patient, but it can just destroy the local anatomy a great deal. So we, like in this patient, we've removed the tumor, but we've retained the shape of the lip. But that's the tricky part, that's the difficult part, that's the challenge, that's all about with these kind of hemangiomas. Because if we remove the entire lesion, entire tumor, he's going to have this much part of the lip missing. That's not a good idea at all. So to remove the lesion, yet give the patient maximum cosmetics or maximum prevention of deformation or deformity creation. That's what is important. And you can see, even though it's a big one, and I showed you earlier, this is just the tip of the iceberg, what you see here, because really there was a large tumor inside the nose as well. Okay, do we have any more questions?
Does it reoccur after surgery?
Yes, some of the hemangiomas do recur, especially when we do resections which are not total, which are not complete. There's a small chance that there could be a minimal recurrence. So depending on where the lesion is, depending on the vascularity, the flow, then we sometimes do not excise it fully, even if there's a small chance of recurrence. But by and large, there isn't a recurrence if it's done well. Do you have any more questions? Alright, so one point I wanted to add with regards to the management of hemangioma. A lot of the patients are contacting us with their photos, videos, MRIs, MR angio, CT scans and so on and so forth. But do remember, it's very, very hard for us to give you a precise, clear idea on a video consultation or anything. I think that's what happened with you as well, right? So this guy's dad contacted us, and he was in another country, and you know, it's very difficult for us to really find out and give exact details. So I tell the patients to give us as much inputs as they can, but also you have to understand that we'll have to still examine you, we'll have to still see a MR angio, everything, and so it sometimes will be like you have to plan a longer visit here. I would recommend around 15 days, couple of weeks, because we sometimes take a day. In your case, how long would we take for the scan and everything? 1 or 2? 2 days. So we took a couple of days in his case to get the MR angio and the blood and everything done before we started the surgery. So you have to give a day or 2 for that. And then this is just day 3, so we like to see the patient at least for 10 days post-surgery. So that's 2 weeks almost. That's why if you're coming from any other Indian city or any other city from outside the country or any other parts of the world, do remember that we like you to stay with us or be around here for about 15 days. What's that? Oh yeah, so we've also got some, my team, they've also got some before after pictures, and you can see, you can see as well. So this beautiful girl, she came in from Mozambique or Angola or somewhere like that, and her dad sent that picture for us a few weeks later. This guy is from Delhi. He's come here a couple of times, and you can see this hemangioma was involving the lip, also the lower part, and you can see he's got nice hair growth there as well, and he's very, very happy, and so are we. This was yet another very challenging hemangioma. Not a very common sight, the nose. I did mention you get hemangiomas in the nose. It's not as common as the lip, and you see it's deforming the nose in a very bad way, and that's her. Again, few months. She lives in another Indian city, and this is the tongue. And again, you can see she was having major problems with eating, with speaking. Every now and then it would bleed because when you eat, you bite on it and then it bleeds, and then you have to apply pressure. And that's after surgery. Yes, the tongue looks a little bit narrow on that side, but she doesn't have any issues with speaking or with eating. We have some more. So this is another patient. She had a hemangioma that was not that visible from outside, but you can see it had eroded the inside of the upper jaw, and the lower lip was not in line. And there, look at her, she's smiling, and she doesn't have a scar or anything. So we've got, is that it? Yeah, so just a few of our patients. These are not all of our patients. We've had hundreds and hundreds of hemangiomas over the last years. I mean, so many of them, you can find literally hundreds even in our YouTube channel. It's, I have to mention one point now, it's about the anesthesia. So because these tumors are very vascular, they bleed a lot, you need to have a very, very good anesthesia team. These are not anesthesia team, but we have an excellent anesthesia team. So they give us like super low BP or hypotensive anesthesia so that we can work on lesions like this without having much blood loss, or with having very, very minimal blood loss. That makes our life so much easier. That's enabling us to perform consistent results. So a very, very good anesthesia team is absolutely mandatory, especially when we operate on any of these hemangioma patients. So thank you. I hope this was useful. If you have any more queries, any more concerns, you can shoot them down and we'll be more than happy to answer them. We also will give you a WhatsApp number where you can contact us if you have any personal queries regarding your treatments or regarding any advice that may involve hemangioma, an arteriovenous malformation, Stooge-Weber syndrome, port wine stain, so many different capillary hemangiomas, or any of these kind of lesions. Okay, thank you. Thank you all.